you so much. We'd like to say good afternoon, and my name is Ray Dick. I'm the health director here with the Town of Westford. I'd like to personally thank you all for joining us today as we recognize May as National Mental Health Awareness Month. Mental health is a very important part of a person's overall health and well-being. Yet mental health affects millions of people and their families nationwide. According to the Centers for Disease Control and Prevention, as we know as the CDC, 1 in 5 adults report having a mental illness in Massachusetts. Some of those symptoms of mental illness are anxiety, depression, sadness, changes in mood, and hallucinations. Mental health illness can develop into more serious health disorders. Just to name just a few: post-traumatic stress disorders, bipolar disorders, depression, schizophrenia, eating disorders, and thoughts of suicide, self-harm, and many more. If you or a loved one are experiencing any of these symptoms or illnesses, you are not alone. The community here in Westford has many resources that are available for residents of all ages. Today we are privileged to have with us Jackie Zegowitz from Sea and New Sun, which is the SANS Foundation, Senator John Cronin, Emma Cotali, representing Congresswoman Laurie Trahan's office, and the Westford Town Manager, Kristen Lass. Also in attendance is Nicole Laviette, our Community Health and Wellness Coordinator. So we'd please first like to welcome Jackie to the podium.
Did you know, on average, there are more than 130 suicides every day. Every 11 minutes, we lose either a brother, sister, son, daughter, mom or dad, or even a friend to suicide. My name is Jackie Zegowitz, and I represent the Sea and New Sun Foundation. SANS was initially based out of Littleton and founded in 2002 by a group of concerned citizens bound by the shared tragedy of losing a loved one to suicide. SANS is unique in that it is the only suicide prevention organization of its kind, working directly with school administrators to fund suicide prevention programs and to reduce the stigma associated with the discussion of suicide within secondary schools. SANS primarily operates at a grassroots level, working with schools, churches, first responders, local organizations to raise awareness of the true nature of suicide and mental health needs throughout the community. I want to share my story. 1983, I was 13 years old. My mom and dad just got home from the hospital with my brand new baby brother, Michael. I didn't give mom and dad a chance to exit the car as I scooped him from my mom's arms. I'm the oldest of 5. Michael is the youngest. We were always a close-knit family. Family was everything. We spent holidays always with grandparents, uncles, aunts, cousins. We lost our parents first in 2009 and 2011, but we the siblings always remained super close, and Michael was definitely the glue that bound us together the most. On February 4th, my daughter turned 12. Michael loved to shop for his little nieces and nephews. It was a week before her birthday. He'd already picked out the perfect Old Navy outfit, even the shoes. He had it wrapped and ready for the family party for February 3rd. He never put shopping off to the last minute. February 1st, at home, enjoying my daughter's birthday party with her friends. It was a sleepover. The kids had so much fun. By the end of the night, I was exhausted. I think I was grateful to climb into bed around 11 p.m. I can't quite remember. In the meantime, Michael, some family and friends were out somewhere for dinner and drinks. The phone rings about 1:15 a.m. Hello, Michael, are you okay? He asked me to come pick him up. I asked him where he was. My heart sank. He had been arrested and in jail. He was not right. He was so upset and told me he was humiliated. Michael, it's going to be okay. I'm coming to get you. My husband insisted on picking Michael up. I had a long day. I surrendered and Jim left to pick him up. I woke in the morning to fix the girls' breakfast before the ride started to show up. The phone rang as kids were gathering their things and parents popping in to thank me. My sister called, and I still can't believe that words that came out of the phone. I kept myself together till all the kids were picked up. I couldn't believe it could be true. No way, not Michael, not Michael. I had to see him. February 2nd was the worst day of my life. The days, weeks, months followed were even worse. I had 3 young kids at home. I was a stay-at-home mom. I functioned. I had to. I got up with the kids, made them breakfast, lunches on the bus. As soon as the bus left, I would cry myself back to sleep. I would be outside when the bus dropped off my kids, do their homework, and make the dinners. I couldn't wait to go back to bed. I couldn't see or even want to be around anyone. I wouldn't even take phone calls. I just wanted to be left alone. I struggled a year or so, not sure how to move on, what I should do to help with my situation, as well as others. But here I am. My brother Michael was a graduate of Sacred Heart Grammar School, Lowell High School, and the University of Massachusetts Lowell. He was a popular English teacher at the Lowell High School Freshman Academy. He loved teaching, and he loved his students. Michael was a devoted brother, nephew, uncle, and son, friend, and a teacher. He lived life to the fullest, and he cherished the time he spent with family and friends. Mike was the guy who was always there when you needed him. He could cheer you up with his contagious smile, which you couldn't help but return. He was warm, he was loving, and huggable. He always had a positive attitude. He was always active. He enjoyed camping, going to the beach, working out, traveling. Mike was the most amazing uncle to his nieces and nephews. He could fill any room with laughter and made friends wherever he was, with whomever he was with. Mike was great at everything he did. He was all about getting things done. Mike was a good listener, and he was an intense motivator. 2 qualities that made him a good person and a great teacher. Losing him was crushing, but ultimately inspired and motivated me to help as best I can, which has led me to bring me here representing SANS. Our mission is simple: try to prevent suicide. We believe that education is the key to prevention. Since SANS started its virtual mission, multiple reports of suicide prevented have been attributed to our work, and numerous individuals have benefited from our programs. We provide monthly survival meetings that meet twice a month, moderated by one of the founding members of SANS. These meetings are conducted in Littleton and have been in progress for over 20 years. SANS puts together suicide prevention care bags that our first responders carry with them to hand out to those in need. They contain information about available help, pamphlet about our foundation, how suicide is preventable, a suicide resource card, along with a notebook, pen, and a poem written by one of our founders, Henry Whitcomb, who lost his son to suicide. We provided funding to Westford Public Safety for the Cortico app. The Cortico app is a health and wellness app aimed specifically for Westford's public safety agencies, for the 195 first responders and their families, to better manage the stress and trauma of their challenging positions. In the fall of 2022, we purchased this app at a cost of approximately $10,000 to be provided for our local Westford first responders and their families. Since then, Littleton has reached out to us and asked us for help to purchase this Cortico health and wellness app for their first responders as well. The app is designed to provide a complete slate of tools to provide handheld, anonymous access to wellness platforms, peer support, therapists, one-touch calling, and so on. The main goals of this app is to keep personnel safe, reducing the risk and liability for the department, and providing extensive resources to employees at their fingertips. It benefits employees, departments, and the community as a whole. In addition to our community support and outreach, SANS has also provided private assistance to certain cases. Currently, we're assisting a young lady who is struggling mentally and can't afford the medical care she needs. Through a variety of private communications discussions, SANS has become involved and is currently covering the medical invoices allowed her to seek additional psychological treatment. Recently, SANS have joined forces with the Westford Board of Health to promote mental health in the 988 campaign. The 988 campaign dialing code is intended as a lifeline for those in mental health crisis, developed through the National Suicide Hotline Improvement Act of 2018 and the National Suicide Hotline Designation Act of 2020. Text to the number 988 also provides access to the lifeline, helping those inclined to text rather than call connect to this resource. In order to help promote the existence of this crisis line, SANS has recently designed 988 Text SAM decals, which the Westford Police have now displayed on the emergency vehicles. Surrounding towns and a variety of individuals have reached out to us, asking SANS to supply them with the 988 decals as well. We've had inquiries from as far as Tennessee asking for 988 decals. SANS is also working with the Westford students to create a 988 video to help promote the service. The best video will be awarded a $1,000 scholarship for their efforts. See Your New Sun does fundraising throughout the year and encourages volunteers in any way possible. One of the best events is our annual gala, a formal affair. The event includes dinner, dancing, live band, along with lively auctions and actions and raffles throughout the evening. At our last event, SANS raised over $36,000, a percentage of which was donated to the AFSP, with the remainder to be directed locally for use in our efforts. Every year, we offer scholarships to local seniors who participate pursuing their career in mental health or mental health-related field. We now offer the Brian Whitcomb Memorial Scholarship to students at Littleton High School, the Andrew Walker Memorial Scholarship to students at Westford Academy, the Gina Duffy Silver Memorial Scholarship at the Groton Dunstable High School. In addition to our community involvement, SANS provides annual scholarships to these three communities in the amount of $7,000. In May of 2022, the Andrew Walker Scholarship was presented by two of his closest friends. These two amazing young ladies shared their story of the sweet, kind, and loving friend Andrew was, and how they wish they had known to read the signs. The presentation wasn't easy for them, neither is recognizing the signs. This wasn't easy, but we are now having the conversation. Thank you. I think we want to just share some of the names of the loved ones that we've lost. I'm going to begin. We'd hope to have their faces surrounded on the common. But instead, we're going to share their names. We have Doug Lake, Edward Stopra, Eric Freiberg, Gary Johnson, Gina Silva, Jack Dufour, Jess Barkis, Jim, Joan Ellis, and John Mahoney.
John Rukako, John Clausen, Joshua Marquise, Cal Conseneva, Keith Crocker, Keith Lally, Mackenzie, Martin Roach, Mary Ellen McGrath, Matt Gittner, Matt Matchett, Matt Dubois.
Michael Dubois.
That was Michael Dubois. We have Michelle DeLorean, Norman Weeks, Paul Bartlett, Philip Steinman, Rick Hillman, Robert Hintz, Robin Gamuchian, Roger, Ryan Marinelli, Ryan McCusker, Scott O'Toole, Tim, Tom Driscoll, and Tony.
14 years ago, this group came together by the death of Westford police officer Billy Duggan. Andrew McKeon, Andrew Walker, Bill Stone, Carol Thornburn, Chris Bennett, Colin Rockwood, Connie Tolar, Cindy Harron, David Morton, and Donald Walter. Those are the faces that we wear on our shirts. Thank you. Thank you.
Thank you, Jackie and SANS. We're now going to have Senator John Cronin.
I thank you. It's great to be gathered here with you all today. I have the privilege to represent the town of Westford in the Massachusetts Senate since January, and it's so good to be here in town with you on the Common. I want to talk briefly about two things: stigma and our mental health system. Stigma is a barrier just like transportation or insurance or your access to psychiatry or any type of treatment. It acts as the same type of barrier for people to get the treatment that they need and help. And so I want to thank everybody who's here today, who told their stories, who talked about their family members, and everybody who's here on the Common today for their commitment to raise awareness, because when we tell our stories and they're hard and they're deeply personal, the stigma gets a little bit smaller and the barrier gets a little bit lower, and maybe one or two or three people who otherwise wouldn't seek help or wouldn't admit to somebody that they love that they need treatment, one or two or three or an entire community will go and seek help and get better and become whole. And so that is why it's so important for us to be here and raise awareness and tell our stories and honor those who we love, who we've lost, who are fighting mental illness. I come from a family with 2 siblings that have suffered serious mental illness. And our family's life during my lifetime has been before and after. And there is, and it was a departure really unlike anything that my family has faced. And getting care and making progress is so difficult. And we have so far to go to have a mental health treatment system that we could be proud of. And we've got a lot of work to do. I want to talk about a few things that we've done in the Massachusetts legislature over the past few years that I believe have moved the needle forward and made our system just a little bit better. The first is 988. So it's a national hotline that people can call to direct them to services. That hotline's no good if there are no services to go to, and treatment is unavailable, especially for people who are poor, impoverished, who might not have commercial insurance. We did 2 things in the legislature last session that I'm really proud of. The first is we committed $400 million in federal relief funds to mental health treatment, $122 million for loans and scholarships to build the mental health workforce of the future. Right now, today in Massachusetts, we have 600 licensed beds that nobody can access and nobody can get into because we don't have the workforce to support them. So we need more psychiatrists, we need more psychologists, we need more sitters, we need more mental health counselors. You name the credential level, we have a lot of work to do to get there. The second thing that I draw your attention to is last year the state launched 25 community behavioral health centers. So for far too long and for far too many families, the only resource available for people in crisis has been to go to our emergency departments and sit in our emergency rooms. And for people who have encountered that experience, like me and my family, that is not a place where people are getting the treatment that they need. And it is not a system that is designed to treat people who are in a mental health crisis. So the state launched 25 community behavioral health centers last year, and I will end by just telling you a story that gives me hope. And hope isn't something that we encounter when we really try to address in a practical and deliberate way the mental health crisis that's in our community. We have got dozens of emails in our office over the past 2 years from people who document the failures with the mental health system in North Central Massachusetts and Middlesex County. But I'll share with you one that gives me hope. It was a Westford resident who emailed my office 2 months ago. They called 988. They were directed by the person who took their phone call on 988 to go to the Community Behavioral Health Center in Lowell. So they got their son, who was in a mental health crisis and in decline and needed to be stabilized, into the car, went to the Community Behavioral Health Center, stabilized their son, saw a clinician immediately, and got a follow-up appointment within the next 7 days. That is something that everybody and every family who has a loved one who's in a mental health crisis deserves. So that is the path that I think can improve the system that we have. You have my commitment in the legislature moving forward to make sure that we make systems like that stronger, that they're more accessible to everybody in our community, and that we can keep chipping away at a problem that every family in every city and town in this state has a connection to, and that we need to make better. So thank you very much again for being on the Common, and I look forward to joining you next year.
Emma Coatley is here representing Congresswoman Lori Trahan's office.
Hi everyone, my name is Emma. I'm here representing Congresswoman Lori Trahan's office. I'll be brief, but the Congresswoman unfortunately couldn't make it today. She wants to send her sincere appreciation for everything that everyone is doing here to, address mental health and reduce the stigma. So I will present this Congressional Recognition Certificate. Certificate of Special Congressional Recognition presented to the Town of Westford. Upon declaring the month of May as Mental Health Awareness Month, your efforts of increasing awareness and understanding of mental illness is critical to the well-being of our communities. Your commitment to reducing stigma and discrimination while promoting accessible services for those with mental illness will forever leave a lasting impact on our community. Thank you.
And now we have Scott Hazelton from the Select Board who will read the Mental Health Awareness Proclamation.
Thanks. 1985, I was a brand new EMT in a town a little ways west of here. And one of my first calls was a young lady, late teens, who had tried to commit suicide. Unfortunately for her, a friend had realized her situation, called for a wellness check, and we were able to get there in time. But we had no ALS at the time available, so I had to talk to her to keep her awake when we were at the hospital and find out what had happened to get her here. And she had a boyfriend and wanted to move in with him, and her parents had said literally, if you move in with him, then don't come back. And when he broke up with her, she believed them and decided to end it. Fortunately, I think two things happened. One is, she had good friends who checked in with her. And secondly, we have in this town and in that town great first responders, our police and our fire, who react and sometimes can't do it, sometimes are able to make a difference. So the stress on them is pretty incredible. And so thanks to our police and our fire for the work they do when all else is failing. So I'm actually very pleased to present on the part of the Board of Selectmen a proclamation declaring the month of May 2023 as Mental Health Awareness Month. Whereas mental health is essential to everyone's overall health and well-being, and whereas mental health illnesses are real and prevalent in our nation, and half of us will have a mental health diagnosis at some point in our lives, and whereas all Americans experience times of difficulty and stress in their lives and should feel comfortable in seeking help and support to manage these times, and whereas there's a strong body of research that identifies behavioral health risks and supports specific tools that all Americans can use to protect their health and well-being, and whereas stigma can be reduced by increasing the awareness of mental health and available resources for those with mental health conditions, and whereas greater public awareness about mental health wellness can positively transform attitudes about and towards people with mental illness, making it easier for our residents to seek help, and whereas good mental health is critical to the well-being of our families, communities, schools, and businesses, now therefore, the Town of Westford, Massachusetts, does hereby proclaim the month of May 2023 as Mental Health Awareness Month. We also call upon all Westford residents, agencies, public and private institutions, businesses, and schools to recommit our community to increasing awareness and understanding of mental illness, reducing stigma and discrimination, and promoting appropriate and accessible services for all people with mental illness. Approved by the Westford Select Board actually at our April meeting. So thank you very much.
So the rain held out till right now. So we wanted to thank you all for coming. We wanted to thank you all for being present and aware, and we want to share and echo that you are not all alone, that we are here to support you from the Town of Westford. We have resources, supports, and services here for any resident, for friends, family, for anyone. You can reach out to us. Our information is on the table. If you have questions for loved ones or yourselves, we are here as a town to support you. One more piece before we end. Recently, the Select Board did approve a Community Behavioral and Mental Health Committee that has residents, has departments, has area supports as SANS as members. And there we come together to talk about what is occurring in our town, what supports can we bring, what resources are here that we can continue to advocate for all residents. So again, I just want to thank you all, and we appreciate you being here today. Thank you.